3, 2, 1.
Welcome everyone to our roundtable with our mental health and substance abuse treatment professionals here in New Hampshire. It's so great to be back with many of you to continue the conversation that we have been having throughout my years in Congress, and to hear firsthand from each of you about the impact that COVID-19 has had on the work that you do to address substance misuse and mental health in our Granite State communities. We have many challenges, and it is important that we remind viewers and constituents of the challenges you face and how important this is for families who are coping with mental health and substance use disorder to know that they have the support that they need. So as founder and co-chair of our bipartisan opioid task force in Congress, earlier this year, before the outbreak of this global pandemic, our task force unveiled bipartisan legislation to address the opioid epidemic by bolstering prevention, treatment, and recovery, as well as law enforcement efforts. The agenda takes on the criminal justice and economic hurdles that have contributed to the growth of this crisis, the opioid crisis. Now more than ever, we need to continue our work and the progress and efforts we have made as we combat the dual public health crisis and recovery of COVID-19 and the opioid epidemic. I was proud to support the CARES Act, which provides a total of $425 million in behavioral health funding. And the House has passed over 100 days ago the HEROES Act, which included $1.5 billion for SAMHSA's Substance Abuse Prevention and Treatment Block Grant, $1 billion for the Community Health Services Block Grant, and $265 million for emergency response grants to address behavioral health needs and to create an emergency mental health and substance use disorder training and technical assistance centers. Further, I led efforts to ensure parity and access to telemedicine to those living in our rural communities, as well as many of the clients that you serve. Now, as House leadership negotiates with the Senate and the White House on desperately needed agreement for the COVID-19 relief funding, I will continue to advocate for adequate and robust support for substance misuse and mental health services. So thank you again for taking the time to be with us this morning. I look forward to hearing your updates, and now we'd love to hear from each of you. And I think, Shauna, you will kick it off, and if each person could just introduce themselves and their background, and then we'd love to hear from you on the challenges that you're facing during the COVID pandemic.
Great. Thank you, Congresswoman. It's nice to be here and nice to see you again. Really like to do this in person one of these days, but we'll take this. So
absolutely.
So my name is Shanna Large. I'm the director of the Substance Use Disorder Program at Riverbend, also known as Choices. And so we definitely have the benefit of the mental health and substance use treatment in our community here in Concord. And we are thankful for all your support that you've given us, and glad to hear all the work that you're doing. It's been wonderful. So some of the things that have happened since the last time we had a conversation, feels like it was a year ago at this point, but I think it was only a few months ago, was that, you know, when we did get into COVID, we did lock everything down and we're doing everything via telehealth. But we did notice that clients were struggling even more with this, because with this disease, they need everyone. They need a group of people to help them be supported through all of it. And so we really worked hard to open back up as soon as we could, to do it safely. And that's what we've been doing over the past month, is actually beginning to host groups again at our facility with PPE and the 6-foot distancing, which I don't know whether anybody has sat in a room with a few people with masks on for 3 hours. It's not the most comfortable thing, but we have noticed that our clients are thankful to be here. But one thing we have noticed recently, which I'm sure I feel like a broken record, but is that the alcohol intake is a lot higher than it's been in a very long time. And we know that alcohol sales have increased across the state, which we know is definitely contributing to that. And then one of the other things we've noticed is that there is apprehension to come back into treatment because of COVID being out there. So we're still very concerned about that, about our population and how to reach them. We do notice that detoxes, which we do not have at our facility, are difficult to get into at this moment in time, because that is the level of care that people are really going towards, which is wonderful. We think that's great. But it's like, where are the people for the longer treatment, like the intensive outpatient and the one-on-one care? It's almost like people feel like they can do it themselves. And we really just want them to know that we're here, and we're going to continue to strengthen what we've got going on and try to outreach to all of them. But being a director of Doorway as well, it just all echoes everything I just said. Not only are we treatment side, but we're also the referrals to service. And you know, I would continue to ask, if we can be so bold to ask for continued support to open up these financial money that is coming into the state to be more than just opiates, to be alcohol and other drugs, because of the increase that we're seeing in all this. So that's my big ask on the treatment side. And I know it's something we've discussed before, so you already know that I always ask that.
Yeah, no, it's important to be reminded. It is very important. Absolutely.
But we are very thankful for all your help that you've given us, and, you know, including us on calls like these, and just really being part of the solution has been wonderful. So I thank you for that.
Great. Thank you, Shauna. Thank you. Amy, who was next?
Kathleen Murphy from Easter Seals.
Hi, I'm Kathleen Murphy. I am the Senior Vice President of Substance Use Services at Easter Seals Farnham Center. Thank you so much for having me again. I know I completely echo mostly everything that Shanna said. It does seem like forever ago that we were on that call. So much has changed, and we've had to, you know, acclimate to so many different changes with the CDC, and things have been a little bit crazy. But we too, you know, some of our biggest concerns, first of all, staffing throughout this. Congresswoman, I don't think much that you can personally do about this, but it is a big issue. Not just initially, we had a lot of staff who were, you know, very nervous or had pre-existing health conditions, that kind of stuff, and needed to step out of the work environment, at least temporarily. But also with you know, schools going back to you know, children going back to school, and children will need to stay home if they are at all sick, right? You know, so I mean, I have 3 kids. They have colds all the time for multiple days at a time. I'm like, wow, this is going to be an interesting winter. So I think we're going to have a lot of staff shortages, which obviously impacts, you know, quality treatment. When you're trying to budget for, you know, we're going into at Farnham Center, our fiscal year starts September 1st. So trying to budget for adding additional staff people, knowing that we're going to have shortages, it's really, really difficult when we're still looking at the reimbursement rates from BDAS and from Medicaid being lower than our cost to operate in any given day. I mean, literally, it's lower. We lose money every time. So when we're looking at that and the need for increased staffing, it's incredibly difficult. I still don't think we have a solid answer. I know that so much of the source funding, and of course the CARES Act, that was incredibly important to help retain staff, hugely important, but some of the source funding has been used for different areas. That $100 a day room and board stipend for those with an F1120 diagnosis, that was supposed to be expanded, not to alcohol, unfortunately, Shanna, but originally, months ago, we were told it was going to be expanded to amphetamines, methamphetamines, which was fantastic. I was thrilled. And now we're not sure if we're going to have that even at all for anybody. So we're looking at huge cuts in ability to collect, income for these clients that we're treating, and yet we're needing to also have staffing patterns that are more substantial than they previously were. We've needed to reduce some capacity in some of our programming, of course, to accommodate social distancing. In some of our larger rooms on our medical detox unit, I know medical detox is needed. So people are like, obviously banging on our admissions department all the time. But we've had to reduce capacity in that department to accommodate social distancing and to really be able to adhere to all the CDC recommendations. I can't put 3 people in a room. It just can't happen. So, that's been difficult, especially with that increased need for medical detox. The telehealth, I know that everybody is so pro telehealth, and it's been amazing, and it has for certain, and I'm thrilled that we were able to move so rapidly, and that people like yourself, Congresswoman, really, really pushed hard for the reimbursement rates to be the same, for the insurance companies to loosen up, regulate. That was amazing. Thank you so much, because we were able to very rapidly pivot to a fully telehealth model in our outpatient setting. But like Shanna said, we are starting to open back up for PHP and IOP. We hosted our first in-person PHP group last Monday, and the turnout was about 75% more than I thought it would be for our first night opening back up. And what that told me was, wow, people are screaming for that connection. We know that that's, one of the major antidotes for addiction is connectivity and connection to other people, and our clients need it. Even our alumni, we have Farnham Center, we have a fantastic and robust alumni program. And we're doing a ton on Facebook as much as we can. We're doing a ton on Zoom, but it's not enough. They're screaming to come back. And I know that you can't do anything about that really either, but boy, they want these in-person groups. We've had to make physical modifications to our outpatient building, knocking down a wall in between 2 group rooms to make a huge group room, and to get creative, but we're still getting some pushback even from insurance companies. It's amazing to me. We came up with the idea, we have, Easter Seals headquarters 5 minutes away from our outpatient building on Auburn Street in Manchester. They have rooms. Yes, let's use one of their rooms. Then the insurance company says, whoa, we need, 60 days notice before you utilize another location. And I'm like, oh my goodness, like, please, people, we're only doing this because of COVID. We gotta get these big rooms. So it's, that stuff is frustrating. But that $100 a day stipend, that was huge, and apparently is not guaranteed, never mind for the expanded diagnoses. And when we're looking at major, I suspect going into the fall, major staffing shortages, that makes me very nervous for the ability, particularly in medical detox, right? Because I can go as a counselor, in my previous job, I can go fill in, I'll teach IOP, I can work as a support staff, I can do any of that, but I can't be a nurse. And if we all of a sudden have, our medical providers calling out because of sick kids or for whatever reason, we're in trouble. So I am worried about that. So would I love to staff up and have double the nurses almost, or 1.5 times the nurses on staff? Sure. Can I afford it? Absolutely not. So, that's just pretty transparent. That's where we're at. Those are the struggles. You're muted.
Yeah, thank you so much for being with us. I really appreciate it, and all these practical concerns are really helpful. Okay, Amy, you can tee up the next.
We have Jake Berry with us from New Futures.
Hey, Jake.
Who,
thanks for being back.
Provide this perspective.
Good to see you, Congresswoman, Amy, everybody. So as I mentioned, my name is Jake Berry. I'm the Vice President of Policy at New Futures. As many of you know, New Futures is a nonpartisan, nonprofit health policy and advocacy organization. We've been working for more than 20 years to address issues related to alcohol and substance use in our state. We've worked with many of you on this call and many others in recent years to build up our substance use treatment and recovery system, make sure it's equipped to meet the needs of the ongoing addiction crisis. Frankly, we're really concerned that without further investment and support, this COVID-19 pandemic is going to undermine the progress that we've made against the addiction epidemic. As you've heard today from Shanna and Kathleen, and we'll hear from others, many of our treatment and recovery providers have been able to access financial relief through the CARES Act. Thank you, Congresswoman, for all your work on that. But many others are still struggling significantly. To better understand the financial impact of COVID-19, New Futures recently commissioned a survey of treatment and recovery providers in our state. What the survey found is that more than 80% of small and large group SUD providers have experienced financial hardship as a result of COVID-19. 48% of respondents were forced to cancel critical income generating events like fundraisers. About 74% incurred unanticipated costs and debts related to PPE or technology costs to shift to telehealth. Based on these and other findings, we projected by October, treatment and recovery providers will have lost at least $6 million in insurance billed income. For these providers, many of whom operate on shoestring budgets, these losses are significant and threaten to disrupt critical treatment and recovery services. I know that Governor Sununu and Gopher, the Office for Emergency Relief and Recovery, did I get that right, Katya? They've directed some additional CARES funding to behavioral health providers. We're especially happy about the funding that was directed towards recovery homes, which, as Kim will tell you, are being hit especially hard. And we're glad that we've reopened the Provider Relief Fund. But the fact is we need more funding. We need these funds to be flexible, able to support our treatment providers or recovery centers or recovery houses and other essential service providers. We've asked the governor and Gopher to direct between $15 and $18 million specifically to SUD providers to make them whole and ensure their stability into the future. In our view, this is critical for the immediate health of our state and for the long-term viability of our treatment and recovery system. And thank you for having me.
Well, thank you very much. And I'm glad you brought up the funding. Part of the challenge for us at the federal level, and I think here in New Hampshire, we did work well in a bipartisan way with the all Democratic federal delegation, the Republican governor, and a lot of conversations and negotiations behind the scenes on, but at this point, we're talking about $4 billion that have come to the state of New Hampshire, but we don't control the distribution of that. And I think the governor's taken a particularly, you could call it a hands-on role, but it's like he's just distributing the funding in ways that it's been challenging for us to impact. So I think it's really important for you to, speak up about what the needs are and where the needs are. And I think that's the concept behind the committee. So I hope you prevail in that.
We're working at it.
Thank you.
For sure.
Yeah. Great. Thank you, Jake. Thanks for being with us and for everything you do with New Futures. Thank goodness we have an advocacy organization for, for this sector. All right, Amy.
We will now turn to Katya Fox, who is the Division Director for Behavioral Health at New Hampshire Department of Health and Human Services.
Excellent. Welcome, Katya.
Thank you, and good afternoon to everyone. First and foremost, I want to thank everybody who is part of this roundtable for the role that you have served throughout this pandemic, because you're our partners and you are on the front lines and you're doing the work that needs to get done to continue to support the individuals that we all serve and the ones that we are expecting to be new to our system. So having the infrastructure in place from previous efforts and current efforts has served us well. But there are, of course, some areas that are continued to be challenges. And those have been raised most pointedly by Kathleen about the state opioid response funding. So we've been able to use that funding to fill a lot of gaps within the substance use field. And we have submitted on May 10th our application for what is known as State Opioid Response 2 for an additional 2 years, $28 million a year for the state. Our current application, our current grant expires on September 30th. And so that is what the concern that's being expressed, very appropriately so, is that we have yet to receive notice of the award. And we, as the application calls for, supporting all of the services that were stood up with the first round of funding. And so that's really important for us to get notice, because as most people know, in New Hampshire, there's a process that we have to go through, including accepting and getting approval to expend the funds. And then there's the whole contracting process. And I believe we have in the neighborhood of 32 contracts that are being supported by state opioid response funding. The other thing I should mention is that we also are concerned about the ability to have the providers, as mentioned by Jake, who recovery housing, respite housing, some rental assistance, and other efforts, that money expires on December 31st. So that money not only has to be in contract by then, it has to be spent by then. And we're not sure that that's the best way going forward to support this effort and the everlasting effects of the pandemic. So to the extent that we can have some relief from that, in addition to the additional funding that we foresee is going to be required, because we are watching our data and we're tracking our data very closely. And the good thing is more people are receiving services. The bad thing is more people need services. And so we're very, very concerned about that, about 6 months, 1 year from now, about the impact of this pandemic. And with that, I'll make sure that others have a chance to speak.
Can I ask you a quick question, Katya? You talked about you have not received the notice. Is this something, where is that held up? And would it be helpful to have a letter from the delegation to shake that loose? Or is that something you anticipate, or is the governor's office looking into it? What can we do to help make sure that that happens?
So it's from SAMHSA, and I'm not sure what the holdup is. We do have a project officer that we meet with and discuss this on a regular basis, and they don't have information to share. So it likely does need to be elevated by everyone, that we need to get that award, because we're already behind the game, given that it's August 25th and the funding expires at the end of September.
So could you help Amy? We could help put together a letter and talk to the delegation about getting a letter out to SAMHSA, the urgency of that.
Sure, and I would request that we work with the governor's office.
Yes, of course.
Yeah.
Yep, absolutely.
But we know, in looking at the numbers, we just issued in our latest report from the doorways, the numbers are increasing. There's and the need is great. So we want to make sure that we continue those services, and again, pick up on the infrastructure that's been built and to be able to expand that.
Yeah, no, I mean, my experience talking with the hospitals and the healthcare providers, they've seen up to a 30% increase in overdoses and overdose deaths. So directly connected to the COVID shutdown.
And we've made such great progress over the last couple of years. And
I know, it's so distressing, honestly. Puts us right back to where we started all this. Yeah. Well, thank you. Thank you for being with us and for the good work you do with the state. It's really important. And we'll help to be persistent and coordinate with the governor's office on that. Great. Thank you. All right, Amy.
All right, next we'll turn it over to Kim Bach, who is the director of the New Hampshire Coalition of Recovery Residences.
Hi, and thank you for inviting me to this roundtable. It's great to be heard and hear and be able to tell you what the house's concerns are. So just to let you know we're a fledgling corporation. We're now fully staffed with 3 full-time employees. We've certified 34 houses that represent 16 different organizations and about 500 beds. So
Wow.
we're really moving along on that process. We always seem to have about 10 houses in process. So there's plenty of work to be done. Since March 1st, we have awarded $95,000 in housing assistance to people in recovery. That's about 213 people. It's an amazing amount of help. It came from a very generous grant from the state, but it's still about 1/3 of what we could do, unfortunately.
Yeah.
About 22,000 of that between March and June was really related to COVID. It was related to people who became unemployed because of COVID. So we see the need of that, depending on how unemployment benefits go, the need of that is going to fluctuate. As unemployment benefits disappear, we're going to see a lot more need for assistance for people who are unemployed because they're usually in get well jobs. Those jobs are restaurant jobs, Dunkin' Donuts, that sort of thing. And they're not very stable jobs. Fall is quickly approaching, and we're already seeing an increase in the number of referrals that are trying to get into recovery residences. We expect this to dramatically increase as the weather worsens. There's not enough beds in Hampshire to fill the demand. There wasn't enough beds before COVID. Now we need more social distancing, so there's less space available. Unemployment's still high. That correlates to an upswing in opioid use, and as you suggested, there's an uptick in overdoses and in deaths because of that. Detox, as other people have said, it's hard to get in. We're understanding a 4 to 6 week wait for detox. You've lost people in 4 to 6 weeks. You lose people
Right.
in 4 hours. So detox is a real problem. Isolation is still a real problem. Isolation is a demon for people in recovery. It wreaks havoc with their mind. Telehealth is great. The online meetings, great idea. People need human-to-human contact. They need to be in the meeting together. For meeting people's needs, meeting the house's needs, NHCORE has secured several grants through different organizations to help stabilize the Recovery Housing Network, the NHHFA, the Charitable Foundation, and we also secured a NERF grant from the CARES Act. About $170,000 is what we've been able to secure for help for recovery housing. Governor Sununu did award the SUD grant from the CARES Act, generous award, $1.8 million to go to recovery housing. But as other people have said, there's no yet plan for how that's to be distributed that we've been aware of. Houses are not ready to ask for that money or to be able to explain what their needs are, and there's a very short window for that to be spent. So we're kind of concerned about whether that will actually be helpful to the houses and to what extent that can help the houses. As I've mentioned, we think that unemployment is going to remain high. The need is going to remain high. As the weather changes, we're going to see an influx of people coming into recovery. There's also the increased alcohol sales. For some people, that's going to work out fine. There's going to be a certain percentage of people that are going to be seeking recovery because of that increase in sales. We need to keep the infrastructure of the houses solid. We have been trying to track every source of help that is available. Jake has helped us quite a bit in watching different legislation. The houses fall through the cracks and everything. They don't get help from the CARES Act as medical facilities. They don't get help as Main Street programs. They don't get help through the PPE because they don't have employees. It's usually an operator. So far, they should be getting something out of the SUD grant, but we don't know what that is. So far, the houses are falling through the cracks. They're determined to be essential businesses, so they've been open the whole time. They're providing the services. Their people are unemployed. They're not, the only assistance they're getting is from us when we give housing assistance. So they run on a very fine margin. We're concerned. We've seen 6 houses close so far. New Hampshire can't afford to lose any more houses. So that's the way we see things happening.
So can I ask you a question about the $1.8 million? Is there a process in place for distribution of grants from those funds, or what do you anticipate the process will be?
Katja probably can speak to it better than I can.
Yes, so we're working, and as you know, Congresswoman, we have the procurement process. So I can't go into the details about that, but there will be a request that will be posted for applications that will afford the recovery houses the opportunity to get some of those funds.
Okay, so they'll be a part of it in some way. We just don't know yet.
We anticipate they'll be the applicants, yes.
Okay, and is that funding the funding that needs to be used by the end of the year?
Yes.
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 Okay. And that deadline would need to be extended by Congress? Is it in the legislation? It was in the CARES Act that, okay, we're working on extending these deadlines, but you know, it's good to be aware of. Okay, great. Well, thank you very much, Kim. I really appreciate it. Anybody else, Amy?
Yes, we have Susan Stearns, who's the Deputy Executive Director to NAMI, and she'll speak.
Hi, Susan.
Hi, thank you for inviting NAMI New Hampshire to participate today. We're really grateful to be here. Amy gave me a slight promotion. I'm the Deputy Director, not the Deputy Executive Director, but thank you, Amy. I'll take that back and share that with HR. So I wanted just to highlight a few things that we're seeing here at NAMI New Hampshire. First off, interestingly, when we initially transitioned to our virtual programming, I should say NAMI New Hampshire provides support, education, and advocacy to individuals affected by mental illness and suicide across the lifespan. And we do that throughout the state. Last year, we served over 33,000 individuals. We're only able to do that because we have, a fabulous staff, about 50, but we also have a very dedicated pool of volunteers, about 200 of them across the state, who help make that happen. We're very lucky to have them. When we had to transition to offering things virtually, we saw for some of our support groups that are facilitated by our volunteers, particularly our family support groups, we actually saw there were some instances where there were individuals who had not been able to participate in an in-person support group who were able to do it virtually. We've also seen some folks who have struggled with access, particularly our peer support group connection for consumers. There are folks who have issues. I want to mention the broadband access is huge for folks here in New Hampshire in order to be able to access these services remotely. We are seeing that. And then for some of our folks, just plain not having a device. They have a flip phone. So it's really difficult to participate when you can't see people, even though you can phone in. But we've also had octogenarian support group members who have embraced Zoom and been amazed. One of the things that we saw initially sort of out of the gate was seemingly a decrease in calls to our information and resource line. That has changed. And we are indeed seeing increased calls coming in and increasing acuity as people call about the crisis they're experiencing. Also increases of folks reporting co-occurring substance use and mental health disorders, or their loved one with a severe mental illness is suddenly using substances in a way that they have not in the past. So we are clearly seeing that that is, as we've gotten further into this pandemic, that there's a significant impact there. We also provide a Medicaid-funded service, family peer support, as part of the Children's System of Care. And right now we are currently supporting 300 children with a total of 750 family members amongst them. One of the things that we are seeing this August, typically August tends to be kind of a quiet time for families and kids, and that's not the case this year. Kids are struggling. We're seeing, and I think we're seeing that too with the emergency department wait numbers. I think it was a week ago, we hit our second highest number of kids waiting at 26. They're down to 11 yesterday. But that's pretty significant, and it had been 3 years since we had been at that 27 mark. So, and truly, August is usually almost no kids, right? Because it's just it's summer, it's easier, and usually we see this uptick in September. So one of our concerns is what's going to happen come September with schools, which are going to be, this, as we talked about, this is a stressful time for families, it's a stressful time for kiddos with this return to school, and for kids with serious emotional disturbance, like the kids we're working with, we're particularly concerned. The other thing that I have to mention is we know that suicide is a significant public health issue for our state, and with our young folks ages 10 to 34, it is the second leading cause of death. We are particularly concerned, as we're hearing again through our info and resource line and the families we support, about children expressing more suicidality. And then another piece that we're hearing about and we're really concerned is our older adults and how isolated they are. And I have loved ones who are older adults and who their world has really shrunk in an effort to keep themselves safe. And for folks with behavioral health issues who are older, especially if they're struggling with accessing services remotely, it's really a significant issue and a real concern. And I think we're seeing evidence of that too. We've offered a couple of webinars around older adults, depression, suicide, and they have been immensely popular. And I hate to say this, typically our older adult offerings are not as popular as, say, kid offerings. So I think that speaks to us around, and those are families that are coming in to participate in these webinars, that speaks to us about that there's some real concerns there across the lifespan, but we have particular pockets that we're really concerned about. We're concerned too about, how will we make sure when a vaccine is available that folks with, severe and persistent mental illness will be able to access it and have the support they need, perhaps, to access it. So, there are a lot of things that are stressing a lot of families and individuals living with mental illness right now.
Yeah, that's very helpful mentioning about the vaccines. I'm on the health subcommittee of the House Energy and Commerce Committee, and doing a lot on preparation for the equitable distribution of the COVID vaccine when it becomes available. And I think there is a light at the tunnel. I'm an optimist, but I do feel that if not by the end of 2020, certainly in the first half of 2021, that we will we've now got 7 promising research projects going on the vaccine, and several of them, 3 or 4, are in the, excuse me, just allergies, I'm not sick, in the human trial stage. So this is coming along now. But what I'm concerned about is the urgency of the preparedness and then the distribution, so that we do have equitable distribution and the vaccines do get to populations in need, frontline workers, of course, but people with disability, mental health, urban, rural, people of color, communities of color that have been so hard hit by COVID-19. So it's good for us to think about that as well. Great, well, thank you for being with us. All right, Emily, it looks like you get to that cleanup here. Thank you for being with us from Katie. If you want to just describe to everybody what that is, and then we'll go from there.
So thank you so much for having us. We're so happy to be here today. My name's Emily Shanahan. I'm the Outreach Coordinator for Communities for Alcohol and Drug-Free Youth, otherwise known as Katie. I am representing our Executive Director, Deb Narrow. She couldn't be here today because she is on medical leave. So I do have some updates to share with you about what's going on here at Katie. Just to echo bits and pieces of what everybody was, mentioning before, we have seen a lot of concerns in regards to the isolation that everybody's facing. With social distancing, people having to stay home, facing that isolation, that grief, and that loss. Our work of substance misuse prevention is more important than ever. One challenge that we have definitely been facing is that we're not able to get together in person with our youth leaders. We have a variety of youth programming all the way with elementary school students to high school age students. So not being able to get together in person with them has been a challenge. But we definitely have, as everybody said, kind of embraced the Zoom, and we've kind of been innovative in doing programming via Zoom with them. We've also worked to develop a webinar series for families and children in regards to developing coping mechanisms with anxiety in this fairly challenging time with Lynn Lyons. So that's been really well attended, just trying to meet the needs of the people out there right now in this difficult time. We do recognize too that seniors are a vulnerable population of COVID-19. So we have partnered with our local senior centers to distribute deterrent drug deactivation bags to our community. So those are getting out with meal deliveries and meal pickups at our local senior centers in our area. So that way seniors can dispose safely of their prescription medications at home instead of having to venture out and try to find a drop box or dispose of them in their household trash, which always isn't environmentally friendly. So we have partnered with our senior centers in that way, which has been really successful. And we've also taken this time to really stand up our Central New Hampshire Community Opioid Response Program, which really links people in our central region to resources across the continuum of care, including prevention, treatment, and recovery in our area. We also work to raise awareness, having educational webinars. It's really getting information out there to our community about opioid misuse. We've touched on topics of drug court, medicated assisted treatment, restorative justice, and we also do have an upcoming webinar about harm reduction as well. So like I said, just kind of echoing what everybody was saying before, we have definitely adapted during this challenging time to have our programming and everything online. We are hoping to get back into our local schools and deliver our prevention programming to our students. That is kind of up in the air right now to seeing how everything kind of shakes out with schools, but that's something we're really, that could possibly be a challenge for us to getting back into the schools and delivering that really important prevention curriculum. But we are definitely working on that, but we're just doing our best and, trying to meet the needs of everybody right now.
Unmute again. Emily, that was really well done. Thank you. I appreciate it. You did a great job. Thank you so much
for having us here.
Absolutely. And give my best to Deb, please.
I will.
So, well, thank you, everybody. I think these are really important things for us to take into consideration in future legislation and in trying to get a bipartisan decision now on the second big coronavirus relief package that the House passed, as I mentioned, 102 days ago. So we're hoping that there will be some urgency to that. We do anticipate when we are back in session for 3 weeks in September, that will be coming up on the Congress also has a very big deadline, September 30th, which is the federal budget will stop spending money. So obviously we're going to, I don't have a whole lot of hope for passage of a brand new budget. I wish that could happen, but I think it's likely to be a continuing resolution. And we can certainly use our opioid task force to keep these issues high on the list of priorities for the continuing resolution. And if you have specific suggestions, I don't know if anybody wants to add anything or have any questions from us in the final moments, but certainly you can direct specific questions to Amy Slattery, who's now my acting district director. for these several months up to the election, and just wanted to make ourselves available. I know Amy stays in good touch with you all, but if you have ideas and suggestions, if you'd like us to follow up, Katya, she can follow up with you on that possible letter from the delegation working with the governor's office. We want to make sure that all the funds that New Hampshire is entitled to with regard to mental illness and substance use disorder, that we get that in the door so that we can get it out to our community organizations, whether it's prevention, treatment, housing, long-term recovery. We want to make sure that we're here for you. So anything else from anyone to add? And if not, thank you. Thank you for your patience with us. And at the beginning, it's great to be with you. I thank you. You're all on the front lines, and we're thinking of you every single day. This is a really challenging time, and I'm just so grateful that we were able to do better with COVID than many, many parts of the country. And so hopefully the cases are very low right now. We're down to just 11 people in the hospital in the entire state, and averaging 15 to 20 cases a day. And so hopefully what that will mean is that people will have more comfort coming to treatment live, even if it has to be spread out and with masks and taking all the precautions. But we also know that heading into the fall and into the winter is tough for people mental health wise generally, and it could be very isolating this year. So thank you for everything that you're doing. We're trying to put out positive mental health coping messages on our Facebook and in our communications, but we are very grateful for everything that you're doing. And thank you so much. Take good care, everyone. Stay safe. Wear your mask when you go out. Bye-bye.
Thanks.